So, traditional physical therapy, they're probably going to spend about half the time working on you manually, and the other half the time is going to be working with you on doing some exercises. Whereas here at TheraMax, we're going to spend about the full 60 to 90 minutes working on you with a robot performing robotic muscular therapy. So, RMT is a little bit different from your traditional manual therapy or massage therapy because RMT is going to allow for a sustained pressure over time at a graded pressure, and it can be adjusted up or down based on the patient tolerance. The robot arm will extend to a specific level of pressure and then retract to allow the blood flow. The benefit of repeating this cycle along with a slight vibration is that it allows the muscle tissue to relax quickly and lengthen, not just stretch. This stops pulling your bones out of alignment and allow for a more natural alignment of your body. Well, it is. It is a myofascial release of the muscle tissue that might be causing or will be causing your ailment. But a myofascial release with a robot is going to be faster than your traditional massage or manual release. The nice thing about the robot is it's going to give you a graded pressure that we can control. This ensures that the patients are comfortable. Typically, manual physical therapists aren't able to hold an exact level of pressure over a sustained amount of time, and of course, they don't vibrate. Well, when it comes down to it, it's all about how much you're doing to maintain your health. Ultimately, all patients are responsible for their own health, and in order to keep things the way that you want them to be, you have to keep moving. You have to keep stretching. You have to keep those muscles strong throughout your body. Those patients that do their take-home exercises and stretches tend to get the most out of the therapy and get the fastest results.